frankly, I find the specialty of family medicine sells itself. Maybe I learned this working with my own children in their teenage era. The more I told them something, the more they did the opposite. So it's not that I'm telling people to go into something else other than family medicine, but I try not to tell them what to go into. I look at providing students really a real robust experience and set of opportunities where the specialty of family medicine itself really convinces the student that this is really what I wanted to do. In my medical school training at the Mayo Clinic, they'd always say, learn something from all of your patients. And they were referring to about life, about their walk of life, about their employment, about their circumstance. So when people come in, I enjoyed learning about who they are, not just about their disease and their symptoms. Of course, we cover the usual medical questions and issues, but what goes on in their lives, what's important to them, to their family, that patient. All of our patients have their unique story. Maybe it doesn't sound as dramatically different as the truck driver or the night shift worker and things like this, but everybody has a life. Yeah. And we have to know that life if we're really going to impact on their care. I was in surgery. I was on my surgery rotation, and there was going to be a surgical case. Thyroidectomy was going on, and because of the anatomical area and the number of residents and fellows there, it was quite clear that as a third-year medical school student, I was going to be the person not scrubbing, not going into the case. We were in a very traditional, older surgical suite where they had the gallery, and in came a class of nursing students. And I still remember the surgeon that was in charge of our team at that time saying, well, Byron, why don't you tell the students what we're doing? And I thought, okay, well, I've read about the surgery. I know what's going on. I can't see a thing because there's 10 people surrounding this small area around the neck. So I was able to talk to the nursing students about what was going on in the surgery. We had the thyroid scans. And was able to kind of do a case presentation and got the students talking. And next thing I know, I was still wanting to go on. They're done with the surgery. The students were still there for their 10 minutes. It ended up being more like a half hour. And I kind of apologized afterwards. And the nursing instructor said, no, this was so valuable. We got so much more out of this. And then chief resident on surgery afterwards said, well, you sure impressed the chief there. He was very impressed with your teaching. And it was just something that came natural. I enjoyed it. I got feedback. And I think from then on, I always thought, okay, well, it's teaching is something I want to do.
Dr. Crouse has been instrumental in bringing medical students to Mile Bluff Medical Center and other rural communities, and that exposure of medical students in rural communities helps them decide that this could be a great place to practice. It gives us a chance to show that there are good physicians, good health care, and good facilities out there that the medical students might have interest in, and so Dr. Crouse's role has been very important to us.
With rural, if you really want to make a difference, if you really enjoy that personal encounter, not just in the healthcare, not just in your clinic, not just in your hospital, but in the community at large. You walk by the schoolyard and you see the kids lining up, hi doctor. You realize as you could go look through each one of those kids, maybe they weren't officially your patient, but you know the family, you know the impact you've had on their life, you know there's a story among every person you see. Now, how much more rewarding can that be? What profession can offer you that type of meaningful existence in terms of your professional career? We know, the people that you in the smaller communities, you worship with them, you shop at the grocery store with them, you play softball with them, you golf with them. You live with them. You celebrate their kids' graduations. You mourn with them when a parent or grandparent passes away. But that's the full life circle. I was always struck in my practice in Spooner how often, in fact it always happened, that when I had a patient die, I could almost always count on having a delivery within 24 hours. Even someone like myself, you can't help but realize and see and experience this life circle when these things are going on, and seeing that a full lifespan of activities. It's just so meaningful being part of the individual's life, the family of that individual, and the community you're in. So as you expose students to this type of experience, I'm convinced this is what sells family medicine. This is what sells rural practice. probably the thing that I'm proudest of is conveying in terms of our family is that work isn't work. I love what I do, and it doesn't feel like work or a burden or anything. I mean, I love reading about the latest advances in healthcare and medicine and the science, and so if I got some free time at home, picking up a medical journal isn't work. That's what I'm interested in. I'm struggling with even coming up with the words to say what this means to me, because the honor, the recognition, the being appreciated it means so much to me. In this case, knowing that it was some of my students that nominated me, it was colleagues and peers at the school that supported my nomination. The selection process was through our academy. What more meaning can that be to somebody that's committed, and engaged in education, having your students, your peers, and colleagues choose you as a Teacher of the Year? I'm truly, even now, still overwhelmed at the receipt of this.